Welcome, everybody, to this session. We are delighted to have you along to find out more about our PPI Impact Evaluation Framework. We are delighted to be launching it today. My name is Jane, and I am the PCRN Project Manager with the All Ireland Institute for Hospice and Palliative Care. I am joined this morning by Padraig Cronin from UCC, and we are going to bring you through the process that brought the PPI Impact Evaluation Framework into existence. And also, we're going to bring you through some tips and tricks on how to use it. So, without further ado, I'm going to hand over to Padraig. Padraig was instrumental in bringing this evaluation framework into existence. Last summer, Padraig was our PPI Ignite summer student from UCC. He's a fourth year medical student, and he was involved with putting together the draft impact evaluation framework, which we wouldn't be able to come to this point. So without further ado, Padraig, I'm going to hand over to you and you can take it away.
Pleasure, Jane. Thank you so much for your time, and thank you so much for having me here presenting today on the work we all did last summer. It was a wonderful summer. It's incredibly impactful, literally. So thank you so much for that, Shams. I was kicking off, we'll look at where we started with this project. And when we started this last summer, essentially when the AIIHPC and UCC, the teams spoke, it was essentially looking at how to track the impact of PPI care the literature originally and essentially assess that PPI contribution has been shown to improve the relevance, acceptability, and accessibility of academic research. In addition to this, hospices and care facilities that engage in active research have better patient outcomes and experiences. Again, this is linked to state-of-the-art research practice being brought into the clinical environment. When we looked a bit more about frameworks then to assess this impact, there was a systematic review conducted 3 years ago that identified 65 individual frameworks for assessing PPI in research. And the note of that was that there is no one size fits all approach. And within this, there wasn't actually one for hospice and palliative. And so I suppose this is where this project came from, based upon a framework that was designed in Trinity College Dublin, known as the Research Impact Framework Building Audience-Focused Evidence-Based Impact Narratives document. We decided to adapt this using the information we got from two focus groups working with PPI contributors and researchers. That's essentially how this study came from, was we took the insights of PPI contributors and researchers to develop a framework to measure the impact of PPI on its research activities of the AIIHPC. So there's three domains we looked at this. So it was the research principles of PPI research, as well as the challenges people faced engaging in PPI research. And finally, at the core was ultimately what was the impact, the desired impact rather, that PPI contributors wished from their participation in. We conducted this part of the evaluation because we took focus groups together of 1.5 hours each. So one was the Voices for Care group. This was composed for the PPI contributors, 6 individuals. So 6 contributors, which were 6 females in this case, both north and south of the border in adult palliative care, pediatric palliative care, and patient advocacy. So all these people had been through the system, so they were bereaved from the process, but they had a lot of learning for all of us to take from that, which we could take into the framework. In addition, we also have palliative care researchers from ECRF and the PCRN research networks. So these are the Early Career Research Forum and the Palliative Care Research Networks, early, middle, and late career researchers with an interest in hospice and palliative care within the domain of the AIIHPC. So similarly, this was 6 individuals, 6 females specifically, spread across north and south of the border, both in the clinic and in full-time research. Focus groups were held together, started off with a discussion on the principles of PPI, challenges of PPI, and finally the impacts. And the key outcomes we got from these focus groups, we took the transcripts. There was roughly 2 transcripts of 18,000 words each. So Jane and I had a look at these, and we applied a Braun and Clark 6-step thematic analysis to extract this. And so the key principles that came from this idea was the idea of mutual respect, diversity and inclusion, meaningful research, and empowerment, all of which were emphasized by the groups as being core to this framework along with research. Additionally, some challenges of PPI noted were financial and bureaucratic issues, particularly at the university level in reimbursing contributors for their time, not feeling heard by contributors, the emotional impact on researchers, and the lack of formal training amongst contributors so they can actually tell their story and their lived experience for the betterment of the rest of us doing research. And then finally, the most importantly, the impacts which contributors wish to see in their engagement in research. First is developing knowledge within hospice and palliative care and furthering the field. Next was empowering individuals and fostering collaboration. So within the community, within the hospice and palliative care, and then within the wider outside community as well in the space. Next was promoting change within the training of healthcare workers, specifically the language with which clinicians used in the clinic and how they engage with people in hospice and palliative care, creating a more empathetic environment and seeing that in the long-term change. And finally, improving the awareness in the needs of palliative care, both within the academic setting as also in the public domain and policy changing and shifts in laws that would better facilitate and support. So that was the key outcomes from our study, and I'd like to pass it back to Jane at this point, who carried it forward to full frame.
Super important. Thank you so much for bringing us to this point in the process, and just to say, thank you very much to Porg for all of the hard work. In a way, it left us with an awful lot of work to do because we had to refine all of the wonderful sort of the information and the different ways and the processes down to distill a framework that is usable, because the most important thing about these documents is that they are used and implemented. Firstly, before I show you where it is and how to use it, I'd just like to run through, really what the framework is going to do. So we're going to support researchers to measure overall public and patient involvement. This is something that, as an organization, we feel needs to be specifically measured. It needs to be tracked. It needs to be something that we are gathering information on in order to most appropriately assess the impact. We know anecdotally that it is having an impact, but we want to put a little bit more substance behind that in terms of data. Co-produced outputs across the research cycle. Again, we're aware anecdotally that this is happening, and we're just trying to put a little bit essentially of a framework on it. Partnerships and collaborations established. We feel if we start tracking this, we start having an eye for it, we start monitoring it, that we're going to see some patterns emerging that are going to be very, very interesting once we're in a position to look back on all of the data that we have gathered. Again, public awareness and media engagement. We think it's really, really important that where research projects have got to the stage where they are turning into a public awareness campaign, or they are a public awareness campaign, and that there's media engagement, that also the PPI impact is tracked at that stage. And then 5 then is a summation of all of those points. We're aware that the impact of PPI on research is nuanced. There's a number of different ways in how it can manifest itself, and we're hoping to put all of the pieces together to make a fuller picture around impact. Yeah. Slides on for me. So just about the framework itself, we have PPI impact evaluation framework. So we're asking all of the researchers to fill this out as a baseline. This is to be completed by the researchers in collaboration with the PPI contributors. We're also asking them to hand out PPI contributor feedback form. So this is that the PPI contributors can document their experience from their perspective. We also have a PPI reporting checklist, and this is just for the researcher. This is just a tool to help them as they go through the research and as they're implementing their research, that they are aware at all of the different stages of PPI impact. Now, I am going to share. So this is the PPI impact evaluation form. This is available on the palliative professional palliative hub under the research tab, under the PPI tab. I will be sending out a link to everybody. We'll be making it available. So when you open it, this is what you're going to see. So it's the PPI impact evaluation form. So number 1, overall public and patient involvement. This is the piece that we are hoping that all of the researchers are going to fill out. The framework itself covers research across all stages. Um, it is recommended to fill this out at an early stage of the research. If that's not possible, please do fill it out retrospectively or wherever you're starting in your research process. But it's intended to be started at the early stages. Um, we also want you to think creatively about how you are thinking about PPI impact. There are the traditional indicators for PPI impact. So we have perhaps being named on a journal article and how many views then that journal article will get. So that's perhaps a traditional way of thinking about it. But if we think about PPI contributions, and we think about that, we take a step back and we think about how PPI contributors can impact research. We're hoping to encourage researchers to engage with the framework, to include the traditional impact uh, indicators, but also to think a little bit beyond that if they want to. Just to say before I show you the rest of the form that it's absolutely okay if you want to leave something blank. If you want to take your time filling it out, you don't have to have it filled out and back to us within any sort of time frame. We encourage you to start thinking about it as early as possible in your research. But if you don't have the answers straight away, it can very much be a work in progress for you. So just to start, number one, overall public and patient involvement. This is the first form. So we have some basic information, introductory information. We self-employed in conversation, we're quite conscious that we wanted to include the PPI framework principles in this. We think, everybody at this stage perhaps is familiar with the PPI principles, but I think it was really, really important, and we thought it was really, really important to get the researchers to re-engage with that, to have a look at the list there and think about each principle and which ones, were they working under? Are they working under all of them? Which ones are the most relevant? And could they demonstrate that? Section 2 here. So we're into co-produced outputs across the research cycle. So some of the examples here, did the PPI contributors support development of the research question? For any of these, we're tracking across the research cycle, and research does evolve as it goes on. So if you're missing one of the steps here, if you didn't do that, that's okay. We're not out here to catch anybody out. I suppose we're trying to put all the information together to bring that bigger picture of PPI impact. So I suppose it's just to say to fill it out, as best you can. You can revisit it if you want to. There's a question on data collection and analysis, and then that leads on to knowledge translation. So the one of here is, did the PPI contributors support development of a research study webpage? If they did, have you gone back and looked at how many people looked at it, how many downloads were from it, where is the traffic coming from? So it's just, I suppose, to be thinking as a researcher about, all of the different ways in which PPI contributors impact research, and are we measuring it? Are we looking at it? Are we bringing them along with us? Number 3 then is partnership and collaborations established. Number 4, I mentioned public awareness and media engagement. And then at the end here is number 5. And Porg mentioned this in his introductory section around the narrative impact statements. So this is just the space for you to put some words on the process yourself. We've given you a word count. We're not expecting this to be an onerous job or a job that's going to be too big. We've given you a sample there, but please feel free to write your own. Very quickly, just going to show you the PPI contributor framework, contributor feedback form. So this is the form that you're going to give to the PPI contributor for them to fill out. Again, we've tried to leave it as open as possible. We're aware that we have a lot of boxes to tick. And rather ironically, we didn't want to, we say that we don't want to turn PPI into a box ticking exercise. I give you a whole lot of boxes to tick, which we have done, of course, later on. But for the PPI contributor feedback form, we thought that it would be best to leave it as open as possible. And again, you know, you don't have to write reams and reams and reams and pages and pages and pages. It's just to capture an impression from the perspective of the PPI contributor. And I mentioned boxes earlier on, and this is the reporting checklist for PPI and palliative care research. So this is for the researchers, and it's very much a tool. We would be hoping that by the time, if you start this at the start, and by the time you're down to the bottom, that you would have lots of all of the boxes ticked. I think this is just a guide for what perhaps it should look like or what it could look like. If you're missing steps out of it, it's not a stick to beat yourself with, but perhaps a tool for reflection. And I think, altogether a useful resource. That is the framework. Thank you for your time this morning. I just have some thank yous that I'm going to briefly run through. Firstly, thank you to Porrick for delivering us quite an incredible and extensive resource from which we were able to build this. I'd like to thank Dr. Mary Rabbit, Programme Manager for Research and in the All Ireland Institute for Hospice and Palliative Care, and also the wider team at the Institute. It is wonderful to have such a supportive organisation for a project like this. I would like to thank Dr. Emmy Racine, UCC PPI Ignite, Dr. Jackie Boylan, independent consultant. I'd like to thank everyone in the focus groups and all of the PPI contributors because we had really, really great discussions. It was a wonderful opportunity to get into the nitty gritty of the framework itself. I'd like to thank those who piloted it also. They helped to give us a wonderful steer on the usability of the document. So lastly, just to say the document will be available. We will be sending it around to our networks and it will be on the PAL Hub. Thank you.